Hi there, and good afternoon. We're working together to save our families as well as our communities, and we're all working for our way of life. Thanks for watching Canceling COVID. I'm Tonya Rivens, and we started back in January. We're still at it, folks, talking about COVID and working to get real solutions. I'm grateful for our sponsors. One is Mecklenburg County Public Health, meckcountync.gov. meckcountync.gov. They'd love to hear from you. If you have questions, here's a reliable source that can answer those for you. And you can call 980-314-9400. Also, Groundwater Solutions, a loyal supporter as well. They'll be joining us. Dr. Tracia Black, she will be joining us in just a moment. But let's get started. Right now, companies across the country are scrambling to figure out how to bring employees back to the office. And it has been convenient and a nice twist to be able to work from home. And a lot of people just don't want to go back. So after more than a year remote work, people are saying, I'll quit first, or I just don't want to go back. So 40% of workers in a new survey say they would quit rather than return to the office during COVID, because you know how it is, folks. Some employees have started petitions and have threatened to walk out to protest working in the office. And a lot of companies are compromising and adapting a hybrid schedule. For example, working 2 or 3 days a week at home and then the rest in the office. And the deal is, because we're on an honor system and people aren't always completely truthful. And there was a leader that made dishonesty kind of the way of life. And in our last, or just as recently as the last couple of years. So people just think nothing of it. And then we've got the divide with those who have the vaccine and those who don't. And people who weren't washing their hands before, or using hand sanitizer, or not doing the physical distancing. So I get it if you're going to be in the office with people who really are not going to abide by those rules. So let's talk about a question of the day. Do you think remote work is here to stay? Please jump in the chat and weigh in on our question. I would love to hear your feedback on that. From the business side, it helps cut down some of the overhead if you can get out of a lease agreement or a building that you have signed a lease to lease out. That helps to cut down on that. But are you able to function in that manner as a business? So tell me what you think. Are you working remotely right now? Are you one of those people who said, I'm not going back? Or do you think that remote working is the way of the future? I really would love to see your comments interactively. You guys do a great job of commenting. I see you hopping on. So I just want to hear from you. Please chat with me. That would be really nice to share your comments on the air. So on camera again, meantime, less than half of adults in Mecklenburg, less than half of adults in Mecklenburg County are vaccinated against COVID-19. And those are not good numbers, folks. Health leaders warn this isn't good enough, with variants like Delta quickly spreading. And the warning to get vaccines is growing even louder. Yes, we're trying to do our part as well to share that with you. So people of color, listen up. Here are some interesting facts. According to Mecklenburg County, the number of fully vaccinated African Americans stand at 22%. 22%. Even though we make up nearly 35% of the population. And for Latinos, they account for 14% of the Mecklenburg County population. Only 11% are vaccinated. Those are some numbers that should be fairly shocking to you. It definitely should be concerning because everyone's back out and about. And there are reports of those that have transitioned or passed away recently were people that did not have the vaccine, or they had only gotten one of the vaccinations. And, this is real talk stuff. You can real talk. Cut out all the noise, all the chatter, and focus on what you see happening around you. So we're going to bring in someone who does just that, and we'll bring the comments that we love to hear, and has a whole commitment to our community. And that is Dr. Tracia Black from Groundwater Solutions. She joins us every week and talk about some of these conversations that really should be held that we're not hearing. And so I appreciate you every week. It's been a week since we've had you on. And Dr. Tracia Black, welcome, and thank you for joining us.
Thank you, Tonya. Thank you for having me. And thank you, everybody out there listening.
Absolutely. So we try to understand both sides of the vaccine debate. And you've been done a good job of trying to balance it out as well. So let's talk about the main arguments for those refusing to get vaccinated for COVID-19. What are you hearing?
So here's what I hear, and I sent a clip in today. I was hoping it would be able to play, but I think there were some issues. We haven't been able to get that particular clip up. But one night last week, I was watching Jimmy Fallon. No,
Okay.
not Jimmy Fallon. Jimmy Kimmel, the Late Show,
Uh-huh.
and Wanda Sykes is hosting. And
Okay.
she did an amazing monologue. It was hilarious, but she talked about the pro-vacciners and the anti-vaccine vacciners, and she said right now, dying from COVID-19 is optional. You know, it's like if you get in a bull ring and you decided you want to fight the bull, and the bull hurts you, then we ain't mad at the bull. You know, you made that choice, and that's okay.
All
And so
right.
she equated the choice between taking the vaccine as that. And so it was so clear to me. I kind of had this light bulb moment where I understood both sides so clearly. And I feel like I've always understood, but I think that clearly articulated it for me. So from the pro-vaccine side, there are pros and cons to each decision that we make.
Right. Right.
Those folks who are against the vaccine, I do think it is a refusal. I no longer think it's a hesitancy. I believe it is a refusal. There is so much out there on social media. Uh, um, they're telling us why they're not going to take the vaccine. They do not believe it's safe. But what Wanda Sykes is correct. You have a choice now. The vaccine, for those who are anti-vaccinated vaccinators, the vaccine will protect you in most ways from COVID-19, where you will not die from COVID-19. That is what it's designed to do, and it is effective.
So you're
Now,
you're opinion people, they're saying the main reason is they just don't think, they don't trust the
they
vaccine.
don't trust it. They don't trust the vaccine. But when I saw the Wanda Sykes set, for me, they don't trust the government.
Oh,
That's the problem. If you trust the government, if you trust the United States, if you trust the World Health Order, then what Wanda Sykes makes perfect sense. That why are you not taking the vaccine? But United States, America has created such an environment that they are not trusted. Everything that proceeds out of the mouth of the government, you have a whole set of the population who don't believe it. They don't
well,
trust it. They don't believe it. They don't believe that the government has our best interests. And that's people of all levels, all socioeconomic levels. It's not a racial thing anymore because it's whites as well as people of color who are refusing to take the vaccine because there is not trust for the government anymore.
so that's interesting that it's no longer a hesitancy. It's just absolute refusal. And, in all respect, what happened prior to the new administration done so much damage that we'll have to live with forever. I do think anyone would admit that this whole situation got politicized. And
Yeah.
it doesn't discount the history of what we had. But at some point, you start looking at facts and say, okay, I got to accept and move on. But the fact that this whole issue has become a political football that is convenient to punt around, I get it why people are saying they downright just refuse. Back
I
to the
think
point
the
that you,
process has been systemic, and I think there's some cons, honestly, and I see it on the side of those who are taking the vaccine. You know,
mhm,
the COVID vaccine will protect you from COVID-19. However, there are elements of the vaccination that could potentially cause you health harm over time. And we know that. And that's why there's no FDA approval, because there are no longitudinal data to
right,
say what will happen long term. And so we're saying, what happens with the vaccine is that for 2 weeks, there's a spike protein. That's really what you're seeing in your body. That's why some people might get some minor sickness during that 2 week period. However, we're now seeing at 6 months, there's some other illnesses that are coming along with that. And I'm just being real. And those who are pro vaccine might not want to hear that, but we're seeing folks end up in the hospital with other medical concerns that are not COVID-19, and we're anticipating in a year from now, we're going to see folks showing up at the hospitals with other complaints. We're seeing inflammation around the heart, inflammation in the brains, and we're just seeing a lot of things. So if you take the vaccine, the pro is you probably will not die from COVID-19. That
right.
that is it's highly likely that you're going to get a life-threatening illness. However, be aware that there are potential illnesses in the future. But healthy lifestyle is really the key. Whether you decide to take it or whether you don't, or you don't take it, you've got to be improving your health, because the illnesses are potential. With
Absolutely.
COVID,
So let me
it's going
jump.
to spike illnesses. With the vaccine, it's going to potentially spike illnesses long term.
Right. So
So
let me
we've just
jump
got to
in,
be
Dr.
healthy.
Black. Let me jump in. Let me jump in.
Okay.
So I just want to say to your point, though, in taking the vaccine, even people with any medicine, whether it's a vaccine or any type of medication, there is potential for side effects or long term effects. And we
Mhm.
cannot discount that saying just taking that vaccine is the only one. Is that a true
Right.
statement?
That is an absolutely true
Okay, I
statement.
just want to make sure because the thing
Hmm.
about it is, people. I got a pastor that always says, "I'll take my chances with COVID, the shot versus COVID," and it's a
Hmm.
personal decision, and we know it's personal. And I know you've been passionate and working in the
Hmm.
community, helping to educate our community so that people can make a decision. But one of the things that we also have to point out too is we were losing so many people in our community, and
Hmm.
once the vaccine started to being distributed, it did decrease the amount. Now you kind of talked about it doesn't the vaccine people that are saying no, it's no longer hesitancy, it's just flat out refusal. And you
Hmm.
said, it crosses every social, economic, even politically. Nationally, 85% of Democratic voters say they have gotten or they plan to get vaccinated, but 60% of Republicans are saying the same. But the White House press secretary is saying, the lack of accurate information on vaccines is literally killing people.
Hmm.
What would your expert opinion be on that comment?
Well, I think there's so much information about the vaccine. I think we're inundated with information about it. I don't agree with that statement. I think that when they say the lack of information, it's the refusal to accept the information that is being put out there. Everybody has the information,
That's
they
true.
just don't believe it.
Yeah. So, I mean, for how do you suggest they get around this? I mean, because I do see the efforts are made. Like right now, we're seeing more incentives that are being offered to vaccinated individuals. Do you think these incentives? We've got a chance at $1 million, a lottery here. You've got the gift cards. You've got had the chance for an airline ticket. I mean, there's so much just being offered. A scholarship opportunity for young people. So people who are hesitant about vaccines, what do you say? How do you reach them?
I think you just keep having real conversations. I think if we begin to talk and address the distrust,
Hmm.
we might get some more traction.
Okay.
I think that's the issue, because it's no longer about the vaccine. It's about the trust of our government, the trust of our healthcare. We see things happen around the world that are now buzzing, and it's being tied to the vaccine. Political leaders who are dying, it's being tied to refusal of the vaccine. So
Right.
it's just piling on that it's the trust issue. So we've got to fix that trust issue before you're going to get any other folks who are committed to taking the vaccine. Even now, and I think those numbers that they're reporting, the percentages of those willing to take the vaccine, I think those are actually high. I don't believe it, because I'm out here in the field and I still see the vaccine sites closing. I see the testing sites closing. But I do think that if we can address that, and I heard on the radio today that 15 million people missed their second dosage of vaccines this month. So what's happening out there. I think we've got to start having real dialogue with folks and not skating over what that major issue is. And I don't know how we fix it, because it's a
Yeah.
lot to fix in
It
our
is.
community. And
Yeah.
until those things are fixed, there's a whole set of folks who are not going to take the vaccine.
So some of the people who haven't gotten vaccinated, they keep talking about, and this is a conversation I had with my son, why is it experimental? And I think you already touched on that. In order to get full FDA approval, it has to be observed over a certain length of time. And obviously,
Mhm,
time has never been on our side in this
mhm.
situation. Do you think getting the approval will make a difference in the vaccination rate? Because I know they're trying to get emergency approval now, and maybe that'll make people feel a little better about it.
I think for some folks they will. I think also we have to acknowledge what the problems are with the vaccine and not pretend like it's perfect. It's the one thing that you have to do to be safe. I think we need to acknowledge that there are potential effects down the line. Right now, what you'll hear is maybe, there's a small percentage of people who will have some irritation at the site of the injection. You may have some, cold-like symptoms during the first few days, but they are not acknowledging. And I had a conversation with a doctor in a hospital just 2 days ago, and there was a person having some cognitive issues, and they did so many tests and couldn't figure out what was wrong. And we asked the question, could this be related to the spike protein? And they said, well, we can't say that it is, but we can't say that it's not. But we've been asked not to really focus on those things.
Right.
Doctors can't say that to patients.
Right.
Just acknowledge that there are some risks, just like we do with every other vaccine. If we didn't brush that over and we gave the good and the bad, I think there'd be a lot more trust around this issue. But, there's a party line, and this is what we're allowed to say, and this is what we're not allowed to say. And people are tired of that.
Yeah. Well, as we start to wrap things up again, we appreciate real talk and information for our community. You're out working, of course, a day in and day out. Let's talk about where you guys are today with Groundwater Solutions, because I know you're out somewhere.
We
providing.
are. We are at a movie site here in Charlotte today. That is private testing. We're at University Adult Daycare on John Kirk Drive, and that is available for the public. And we're at Kittyland Daycare in Charlotte, North Carolina. And again, we're always at our office Monday through Friday, 704-596-0505, if you'd like to be tested or if you'd like the vaccination.
And that's groundwater-solutions.org. So, Dr. Black, before I let you go, any final thoughts, and also give you a chance to weigh in on the question of the day, as we hope others will. Do you think remote work is here to stay?
I think remote work is absolutely here to stay. I do not believe that the community is not going back into the workplace. They've realized that they can be just as productive from home. They like working from home. It has improved their quality of life. And I don't think they're going to return to the workplace full time. I think employers have to compromise.
Yeah, not to mention saving on gas and all things. And as a business owner, trying to get, I guess, out of some of the leases that have been signed. But great stuff. So you say it's here to stay. Dr. Tracia Black, Groundwater Solutions, I certainly appreciate you. Thank you for weighing in.
Thank you.
And having the tough conversation that a lot of people aren't willing to have. I appreciate you for joining us.
And my closing thoughts is, let's not attack each other. Let's talk to each other. Let's try to understand. I think my light bulb moment was, let's try to do a better job understanding each other instead of just making each side feel like they're crazy, because they're not. Everyone has valid points, and we just need to cross over them.
Well, thank you again. Thank you for all you do to serve the community, and we appreciate you joining us again. Dr. Tracia Black, Groundwater Solutions. Now, from vaccination talks to mental health awareness, the church is being called on for leadership to weather the storms COVID has caused and created quite a bit of havoc in the community. So what we're going to do now is bring in my second guest, who is Bishop MacArthur Sanders, who is doing so much work in the community. He is a humble servant, getting ready to get a big award for his community service by our very own President Joe Biden. But he's got so much going on and has been a staple in our community. First of all, welcome, sir, and thank you for your awesome leadership and all you do to serve others. Good afternoon.
Well, good afternoon, Ms. Rivens. It's certainly good for me to be on with you this afternoon.
Well, it's always good to have you on as well. And your church is right there on Sunset. Make sure you shout out your church. We didn't even mention Canaan Community Christian Center.
It's the Canaan Christian Worship Center, 1713 Sunset Road here in the city of Charlotte.
There we go. So what comes to mind when you see COVID plague the community, our community of color, at such an alarming rate?
Let me, Ms. Rivens, let me touch bases on something Dr. Black mentioned. I could not be in more of agreement with her when she mentioned that the Black church, our race, has lost faith in the government.
Right.
And in doing this, we feel that they failed us, and it has created a fear among the community to feel that the shot is going to get rid of us more than it will help us. And it has brought something against the church that's very, very hard to deal with.
How do you deal with it, or how have you dealt with it?
from a leadership point, we have to look at our people and deal with them on the level of who they are. We have
Right.
to, first of all, Ms. Rivers, I believe the most important thing that we do, we must make sure that they understand that we're still a church,
Yeah.
that we still believe that God is going to bless us right during this pandemic. The church has suffered more than many of the organizations around even the workplace, because at shutting down the church, you shut down the only income that you have. But
Yeah.
we've got some other avenues that God has blessed us with, whereby we were able to make the difference as we went through.
So, Bishop, please call me Tonya. As we continue this interview, I consider you a dear friend. I appreciate you.
Miss Tonya, I will do so at your request.
All right. So, you minister to the soul, but would you say that you've had to also focus on the body to do your job effectively, especially during COVID? And another thing that Dr. Black mentioned, of course, the issue of healthy lifestyles and adjusting some of the things that we do. What have you had to do around that to keep your job effective?
What we've had to do, Tonya, is continue to tell the people of God to trust in the Lord. As it says in Proverbs 3, 5, and 6, to trust in the Lord with all thine heart and lean not on thine own understanding, but
Amen.
in all thy ways acknowledge him, and he shall direct thy path. Now, here's where we are. We feel that the church has fallen into a bad place because of this awful pandemic, and it has. But
Mm-hmm.
we've lost one of the only fellowships that we've had among our Black race, and that is the church.
Right.
So, what I've had to do during that time was be able to convince the people of God that better days are coming, be able to encourage them to hold on, encourage them to be who they are, encourage them not to think light of themselves because they're not able to do the thing that they once did. And it has worked. It has worked at Canaan. And I know a number of other churches that we fellowship with, that I am the presiding bishop over, that it has worked. And we must continue to do that. We must continue to tell the people in the church to go and get the vaccination, because the vaccination is at least one opportunity that you have to prevent yourself from dying right now. I do know this, that we all are going to die, but we
Right.
don't have to die tomorrow. Am I
Right.
right about it?
You're right. And what you're sharing already is how the church has ushered the community in as the church being the leader, and as always, and will continue to be the leader. So remember the civil rights era, and not implying that anyone was living during that time, but during the 60s and the civil rights era that we had, many cases, ministries, really, they were the ones that were at the forefront that pushed for change for the entire community. Do you see the same motivation during COVID? Is that what's been happening?
I do.
Uh-huh.
Tanya, I see it because I was a freshman in college at South Carolina State University, marched just two persons behind Dr. Martin Luther King
Oh, wow.
during the march in Orangeburg, South Carolina.
Uh-huh.
We were sprayed with fire hoses, and it took all of that to get us where we are today, and where we were able to do things and go to the great jobs, be able to be felt that we were worthy of the different positions that we're in now as leaders in the city, in the state, and in the federal government. And all of a sudden, because of COVID, this thing seemed to have disintegrated. But
Mm.
what we have to do is go back and realize the struggle that we had during that time. And I encourage ministers everywhere, and I hopefully we will have some ministers watching your transcript here, that I will encourage them to know that we need to encourage our people to be who they are. I mean, we're not second class.
Right.
We're not people that feel like someone is trying to get rid of us. We have the same hand in this as everybody. And we're going to come out victorious. I encourage my preachers to preach to the people. Don't feel sorry for them. Let them know that better days are coming. We've had to work through this, but it's just a stepping stone to where we're going.
Amen. So I
Oh,
didn't.
I got you saying amen.
Yeah, you were in the look. You just mentioned marching while you're in college. Let me just share it, everyone. You were a top athlete in college as well. So,
Well, I tried to play a little something.
yeah, right. Okay.
I was mostly there.
You were an all-star in football, but we're going to move on and talk about some of the outreach programs you shared. You guys had to get creative, and you had some outreach programs that you created as a result of COVID that helped to benefit your church family and the community. Can you share some of those with us?
Yes, I will. We have our college here, PTP Christian College. We have PTP Conference of Churches, whereby we assist pastors and leaders in 12 states within the United States and to enable them to be better at leadership and development and causing our people to really reach the potential that God has set out for them. Over the time of COVID, we've been working with them online. Our college classes are online, our training are online, even our ordination classes, whereby we bring potential ministers and future leaders from all different states up and down the East Coast. We bring them to one area, even though we have to social distance, even though we are having to wear masks, but we bring them in for training because training is the key to our success and not giving up on what God has given us to do. I believe that's very important. I encourage all of the pastors to continue to train, whether it's by air, we have to do it on YouTube, we have to do it on Zoom. Let it be something that will keep our people involved, that they will know and understand their place in the world, that they're not second-class citizens.
So, Bishop, you mentioned also that how you made the adjustment with the school. I'm glad you mentioned PTP, the Christian College, but even for your church members, there were some ways that you had to adapt as well because you all were not in service.
It was, and it still is. Even though we are not completely back in service, we are probably 50% of the members are coming back. We're still social distancing. We're still wearing, we have masks optional. We've got a number of people that has had both of their vaccinations. In fact, I encourage people to get the vaccination. I've had it, both my wife and I have had it, all of our family has had it, and it's been good to me.
So how that conversation, Bishop, with especially those in your congregation that are hesitant or just flat out refuse? How are you having that conversation with them?
Okay, what we're doing, and you know, it comes a time, Tonya, when we have to draw a line.
Mm-hmm.
We don't want them not to come to church, but we have to draw a line where we continue with the 6 feet of social distancing. We have to continue, make sure that if you have not had your vaccination, you have to sit in the other part of the church. You have to watch the TV. It's just what we have to do. We're in a situation whereby we have to make some calls that we would just not normally make. You know, I was very surprised, and I was listening to Dr. Black and her involvement in the community, and I want to commend her on the things that she's doing. But I want to say this, as the question you asked me in the very beginning, it's sad how ill prepared America was whenever we became introduced to the pandemic.
Right.
We were ill prepared. We were prepared enough to send a man to the moon. We even got a billionaire now riding around up in space.
Yeah.
But we couldn't do things that will make it possible whereby we could catch a terrible pandemic before it got to the shores of America. I think we were very ill prepared.
Absolutely. And of course, someone has been in ministry as long as you have, and you've got so many other church plants around and elders that work with you. You got the college. The impact of COVID, what other ways has it changed the church? You already mentioned that, you know, certainly the church has suffered, but kind of speak on some ways that it's changed church. The church of the future definitely doesn't look like it did. It won't look like what it was before the pandemic.
Well, I'll tell you this, and I don't want to be a bad news bearer for a lot of my brother and sister pastors, but the church has entered into a stage of normality that we will never go back to where we were 18 and 19 months ago.
Right.
People are very comfortable, Tonya, not coming to church.
Yeah.
Our offering each Sunday right now is greater than it was when the congregation was meeting every Sunday. It's just like people don't mind paying not to come to church. But what we've done, I say that jokingly, what we
I
have
know.
done, we have established a reach out ministry. What we do, we are on Facebook Live each Sunday morning with our services. We are on YouTube, whereby they can watch our services any day of the week. It's recorded live on Sunday morning during our worship, but they can watch it at any time, or they can go to our website at
Right.
canaanchristian.org and watch our services there. And it's more comfortable for the people because there are some people with underlying conditions that's afraid to come out. We
Mm.
understand that. We're doing whatever possibly a possibility we have to make things work for them. We're making it to come to pass, and we're doing pastoral visitations. They just allowed us back into the hospital over the past month to be able to visit. So my ministerial staff does. I've got 16 ministers on staff here, and they have they visit, they call, they work the phones, and it's just something we had to do. We had to adapt to make ministry different than what it was prior to COVID-19.
Bishop McAuliffe Sanders of Canaan Christian. Look, Worship Center. As we wrap things up, is there anything else you would like to share, Bishop?
Tell me again.
Is there anything else you would like to share as we wrap things up?
Well, let me tell you, I would like to, first of all, let me say to you, I am so grateful that you have set up a segment whereby you will address this and let people know that there's a better way. We need to encourage our people. We need to encourage those every different walk of life, especially our race. We're being left behind. And
Yes.
for all that we did back in the 60s, all the times that I was locked up and kept in jail just because I was marching for our rights, we are going to let it slip away. And we're going to let it slip away and not even say anything about it because we have chose to walk a different life. I want to encourage them. I want them to know that there's no other way that we're going to do it without doing what we're supposed to. Get out and vote. And
Right.
don't let your voting rights be stripped away from you for no reason at all. Don't let these days pass because it's going to now where we are, and I'm getting ready to close. It's
All right.
going to take right now, it's going to take 3 or 4 generations to get us back to where we had been over the years. Thank you so much for
Thank
allowing me to
you.
be out.
Absolutely. Thank you so much for taking the time to share with us and drop a whole lot of wisdom. Bishop MacArthur Sanders, he's one of my favorites and just glad to have him on. You can visit him right there on Sunset. It's Canaan Christian Worship Center, as he shared. There's also a college. He's got a school there, and of course, a great ministry that serves the community and has been for years. Well, time sure does fly when you're having fun. We're out of time, folks, but I do want to mention this as I close. Our attorney general here in North Carolina is warning people, be careful. We talked about the incentives, and one is your chance to win $1 million, where scammers are going to scam and they're calling and taking people's information and scamming people, telling them they've won $1 million. So just beware of that, folks. Don't fall for the okey doke, and stay cautious. If you're not sure, get someone and ask questions, but don't give out your information over the phone. Especially my mom, she'll take a call and she'll go, "Well, they keep calling." Well, just don't answer, okay? They can't talk to you if you don't answer. So yeah, somebody's always looking for an opportunity. And here's a good thing, an opportunity to win $1 million. And now people are being scammed. As always, life's challenges make you better, not bitter. I'm so grateful for the opportunity. Thank you for joining us today. Thank you to Mecklenburg County Public Health, mecnc.gov. Also, thank you to Dr. Tracia Black of Groundwater Solutions. I'll see you back here on Friday. Together, we'll continue to work to cancel COVID. Have a great day. Stay safe and try to make sure you stay out of the heat if you can't take it. I love the sunshine, folks. Thanks for tuning in, everyone. Have a great day.